from the American Academy of Pediatrics.
Tummy problems, more formally known as gastrointestinal conditions, are common in kids and teens, and they can significantly impact the quality of life of not only the child, but the whole family. Today, we're talking about a few of those most common ones and how we can help kids.
Some of our sports drinks that we tend to use for soccer, basketball, what have you, they're very, very high in sugar.
Yeah.
And what will actually happen is if your child's already having diarrhea, when they drink this, their diarrhea will worsen. And you think you're rehydrating them because you're using some thirst quencher, you're making the problem worse.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions and the answers will hopefully be even better. Let's get started. Today, I have with me Dr. Pat Reeves, a pediatric gastroenterologist and associate professor of pediatrics at the Long School of Medicine in Texas. He's going to tell us all about some of the most common tummy ailments in kids. Pat, welcome.
Thank you so much for having me again.
We're so excited to have you. Let's start with the basics. Tummy aches, of course, are one of the most common reasons that parents call or visit the pediatrician. How do you begin sorting out what's normal and what might signal something more serious?
Well, Edith, that's so important. And as you said, this is a very, very common problem seen both in general pediatrics and makes its way to pediatric gastroenterology clinic each and every week. And so we start with the most basic of looking for red flag signs, or what others might call alarm findings, things that are scary to mom and dad, scary to the physician as well. And so those red flags are, is your child not growing? Some of the other red flags might be, are they doing things their body shouldn't, like vomiting? We're not supposed to be vomiting,
right.
At least not for many, many weeks in a row. I think kiddos, especially daycare age, first exposures to school, that viral tummy bug is going to happen and they'll vomit. But doing that for a week or so, 10 days and less, that's acceptable. When it goes beyond that, more than 2 weeks, especially if we go on to a month of this happening, those sort of vomiting signs, that's not okay. And then the other side of the GI house, pooping is always important. Those are the questions we love asking. And if your pooping pattern is different, predominantly if you're having diarrhea or red stuff in your poop that looks like blood, those are concerning red flag findings that, when associated with tummy aches, warrant a deeper investigation.
Yeah, and I love that you're framing it like that, because I do think knowing some of those red flags, and when you are able to confidently say they're not present, does give you a little bit more time to try to figure out what's going on, knowing, of course, that some of these things impact a child's life and the whole family's life. So you have more time when these are not present, but at the same time, you have to be mindful, right, that you might have a child who's very miserable or a family who's miserable. So, Pat, I wanted to ask you about a few conditions specifically, and the first one is celiac disease.
Mm-hmm.
For parents who may have heard the term, what exactly is it, and how does it affect the body, Pat?
Absolutely. So celiac disease is going to be one of our more rare causes of chronic tummy pain in children. And it is actually an autoimmune disease where your body, specifically in the small intestine, has decided that gluten, the protein that we find in wheat, is the bad guy. And because they have perceived that piece of nutrition to be the bad guy, there's all kinds of inflammation, like what we call lymphocytes, that are brought into the small intestine to wage war on that gluten protein. And when it does that, it damages the small intestine. It can also damage the liver. And so it is a two-step process, where if we think celiac disease is the cause of tummy pain, we need to keep eating gluten. That's the scary part. We'll talk about why. But we do a blood screening test usually to help identify if the child is a higher risk for celiac disease. And if they are, oftentimes we will take them to the endoscopy lab where they're fully asleep under anesthesia. We will pilot a flexible camera called the endoscope into their GI tract, take a look around, and take teeny pieces, millimeter sections of tissue off the top of the surface of that small intestine, which we call biopsies, and look at it under the microscope. That is the gold standard way to diagnose celiac disease.
And I am so curious to learn why you say if you suspect it, you actually do want to keep eating gluten. But tell me first, what are some of the symptoms that should make a parent or pediatrician suspect celiac disease in the first place?
Absolutely. So our most common symptoms is going to be chronic tummy pain. I will tell you, we do find every year that that's the only thing kids have is chronic tummy pain.
Wow.
But the good point is that just a little bit of a blood screening test can help you stratify if this child is a risk for celiac disease. More commonly, it's belly pain plus more stuff. That more stuff would be oftentimes diarrhea or even the inability to grow properly. Because if celiac disease is present in the small intestine, that's where we do the majority of our absorption and digestion of nutrients. So if that area, kind of like a sponge, is completely destroyed, you can't absorb those nutrients. You'll poop them all out, which is why you get diarrhea. And kids with the belly pain diarrhea may not grow. And in that situation, we are highly concerned for celiac disease and have to go through this playbook of blood screening and then oftentimes endoscopy to prove that it's celiac disease.
Yeah, so interesting. Tell us now, though, why do you say that you actually do want to keep eating gluten as we're sort of working through this and, hopefully arriving at a correct diagnosis?
You got it. So the reason why it's so important to keep the gluten in the diet, to eat wheat and so forth, is because if you start a child on an elimination diet where we eliminate gluten, that may be what we decide a few months down the line. But if you do it too early, then the blood test may already change. And if we take them to the endoscopy lab, the tissue may already start healing because the parent, doing their best, may have actually put them on the right therapy. There is nothing worse than the feeling as a gastroenterologist for children to put a child under anesthesia, evaluate them with an invasive test, come back and say to the parents, I really thought I was going to see something abnormal, but it's normal. What'd you do? Oh, well, you said it might be celiac disease, so we took away gluten. And then we're thinking, So it's also an important part for the pediatrician and for the gastroenterologist to know ahead of time that we always tell parents, do not change the diet. In fact, one of sort of the gluten load tests that we do, 10 grams of a gluten or wheat containing product every day, which kind of amounts to 2 slices of bread, 1 croissant. I say eat that every single day leading up to the endoscopy so that I have the best chance to prove what's hurting your child.
Yeah, fascinating and such an important part of counseling, truly, as you're sort of going through this process. Now tell us, once you do diagnose it, what is the mainstay of treatment?
For celiac disease, thankfully, it is pretty easy. It is going to be eliminating gluten from your diet. We have fascinating research to show that there are some children who will respond rapidly. And as I mentioned earlier, there are some kids who their liver is actually affected by celiac disease. And we see that resolve very, very quickly. There are some kids, strugglers almost, who their body will take up to 2 years to normalize the blood test, even with perfect adherence to that gluten-free diet. So for me, that's the big intersection meeting point that I have with families after the diagnosis is more important than anything else. I want your child to feel better. I want them to start growing better because it could take up to 2 years for the blood test to look perfect. But we expect them to feel better, we expect them to grow better, and for their symptoms to resolve even before the blood test is normal. So that's what we care about. And you can get 99.9% of children in remission from this lifelong autoimmune disease with gluten-free diet alone.
I love that. And from what I have seen, you guys usually do involve a nutritionist, a dietitian to help families sort of start the journey so they can start to heal. Is that correct?
That is absolutely correct. And we are very fortunate in most children's centers nowadays that is a dynamic duo that we and the registered dietitians and nutritionists have available. I will say that while it's unfortunate any child diagnosed with celiac disease, it is not the end of the world because in today's day and age, we have so many more good food options that are gluten-free. And mostly what we end up doing on that first visit with the dietitian, and I'm spoiled because I have a combined clinic. So I'm in there at the room, same time with the dietitian, where we're teaching young children how to read nutrition labels, their parents too.
Yeah.
And we're teaching them what to be looking for so that we can make sure that we're not missing the most key ingredients to avoid so that we can maintain the greatest amount of safety for these kids who are going to potentially have acute pain, acute discomfort with accidental exposure to gluten.
Yeah, I love that. We really are so lucky to be able to combine practices like that, right?
Mm-hmm.
Pat, moving on to another condition that I see frequently in my practice is lactose intolerance. I think people,
Oh, yeah.
right? I think people at home have a good sense of what it is, but define it for us.
So lactose is simply a carbohydrate. It is a sugar. When our body digests it, it's supposed to be broken down into two simpler sugars. One we've all heard of probably is glucose. The other is galactose. And more information on this is on the healthychildren.org website from a fantastic article that Dr. Porto wrote, can kind of give you more information. But in essence, like celiac disease, this happens in the small intestine. Now, our small intestine is very, very cool. I'm a bald gastroenterologist, so you're going to have to go with me. But if I have hairs on my head, our small intestine is very much like that. It's got hairs on the inside. Those hair cells, kind of like a sponge, are what help to absorb all the good nutrients. But what's different than a sponge is that it actually has enzymes on the tips and around the hairs themselves. Those enzymes help to break down the sugars. One of those is lactase, and lactase breaks down lactose to glucose and galactose. And so in essence, the lactose intolerance comes from either having not enough lactase or really zero lactase sometimes. And there's really several causes that can lead to having not enough lactase in your body.
Yeah. So, Pat, at what age might parents notice symptoms of lactose intolerance come up, and what are those key symptoms that they might see at home?
Absolutely. So it is very rare, but infants that are born preterm can exhibit lactose intolerance because of the lacking in quantity, concentration really, of that lactase in their small intestine. And there are even more rare than that, children born with lactase deficiency. But more often than not, this is something that's going to develop a little bit older in life. Really, toddlers is where we start to see this come along. And it is because when you have those really serious episodes of acute viral gastroenteritis, the enteritis of that means that your small intestine is being inflamed. And you can think of that as when the small intestine gets inflamed, it is a haircut on the small bowel. And we lose those little hair cells that we were talking about that are charged with the task of absorption. When you lose the hairs because of the virus causing a haircut, you lose those lactase enzymes for a time. Now, the good news is that we should be able to rebuild those hair cells and thus be able to have the appropriate amount of lactase, but that can take anywhere from 2 to 4 weeks after an infection. And so we see this a lot where we talked about, 14 days, especially for young kids, is a good timing to decide, hey, should I see peds gastroenterology or not? We see so many kiddos who probably do have lactose intolerance because they had that terrible bout of viral gastroenteritis and their body's still healing, but it hasn't been quite a month yet. And we just need to give them a little bit more time.
Got it. So interesting, right? To understand that timing, especially when you're trying to tell apart something that's very common, like a viral gastroenteritis, right? People might know it as the stomach flu from something like lactose intolerance. So now I get this question all the time from parents. What is the test for lactose intolerance?
Yeah, absolutely. So there really are two tests. First and foremost, I would say the test of time. And that is something that we can do at home. So there is excellent evidence to support moms, actually. I love dads, but come on. Moms who are there and moms accurately observing symptoms for their children. So your mommy spidey sense is honest, accurate, and trustworthy. So go with that. Children who have lactose intolerance, if they ingest a large amount of some dairy containing product, something that's going to be high in lactose, then they may get a really, really swollen belly, like what we call bloating. They may have vomiting, but more often they're going to have diarrhea. And that test of time, what I usually say to parents is one big, good 8-ounce serving of whole cow's milk or a big, huge serving of dairy containing yogurt. If your child develops symptoms from that, pain, bloating, vomiting, diarrhea, we are not ready to have dairy reintroduced back to our diet. That is the simplest way to address this nutritional problem at home. Now, we do absolutely have a couple of gold standard tests to help us. So the gold standard is a lot like celiac disease. We go in with the endoscope, and I can take not just biopsies of the small intestine, because when I do that, I'm taking some of the hair cells off. I can actually send that off to the lab, and I can measure the enzyme quantity from that biopsy and tell you, are we missing lactase? What about maltase? And some of the other, we call them disaccharidases, some of the other enzymes that break down these sugars. We can quantify that. That's awesome. In the middle of that road, because it would be great if we have a test to rely upon where we don't have to subject the child to general anesthesia.
Of course, yeah.
We have what's called the breath test. And so that is the hydrogen breath test. And here's where we can get super science nerdy. Sugars like glucose, like lactose, have a lot of hydrogen in them. So if those sugars have a lot of hydrogen, when we ingest them, if we actually have a inability to digest them appropriately, we're actually going to produce a huge explosion of hydrogen. So if that's the case, we can actually quantify that by giving the kids a large amount of sugar ingestion, and then they breathe into what kind of looks like an interesting Ziploc bag, and that is a hydrogen breath test. So it allows us to see if the digestion process that should be occurring based on the gas that they exhale and put into that bag, if we're able to suppose that they have lactose intolerance because their lactase enzyme isn't present in a high enough quantity.
I love it. I love all of the nerdy science behind this, truly, because it can be so satisfying, right? When you get an answer, when you've had a kiddo who's been struggling, oh my goodness, that's like the best feeling when you can give that family answers. Now, much like for celiac disease, the solution here is going to be to take away that lactose, right? To eliminate dairy from the diet. My question to you, Pat, is what are some ways to keep calcium and vitamin D in the diet of a child who now has to avoid dairy?
You got it. So typically what we do in my combined gastroenterology nutrition clinic for these kiddos is we are supplementing. Now, there are vitamins that we have at our disposal to use. And for me, that is easier. And typically, I think it's a more realistic ask of mom and of dad, because trying to find ways, like you said, of getting calcium, vitamin D into these kiddos who can't have a dairy-based source for that, because it's not the proteins of dairy, it's the lactose that's in dairy. But that's our most common way to get calcium, vitamin D into these kids. So we tend to do vitamin D and calcium containing vitamin supplements. Again, pushing you back to one of our great Healthy Children offerings from Dr. Porto, we have an age-based breakdown for this. And so to kind of do the takeaway, my experience is that I get the most questions about lactose intolerance around ages 1 to 3 or 4 to 8. And so when that's the case, if we're talking about the toddlers, they're going to need about 700 milligrams of calcium per day and about 600 international units of vitamin D per day. Now, as far as executing that, if all you can do is set your alarm and your calendar to do this once a day, that's better than nothing. Ideally, giving calcium half the dose in the morning, half the dose later on in the day is going to be better than one dose at all, okay? So if we are going to be perfect, giving 350 milligrams in the morning, 350 milligrams at dinner, that's ideal. But if all we can do is once a day, that's fine.
Love it. And of course, your pediatrician and dietitian can help you do that in a way that makes sense for your child, depending on their age, right? Pat, before we move on from talking about lactose intolerance and relief of symptoms, talk to us about something that parents may have heard at home called FODMAP diets.
I love this, Edith. So this is probably, for me, the most important thing for families to learn about, especially in the theme of lactose intolerance. So FODMAPs are molecules that we find in our food that contain carbohydrates. So it's an acronym. F is for fermentable, O is for oligosaccharides, D is for disaccharides, M is for monosaccharides, and P is for polyols. So FODMAPs, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Leave it to a gastroenterologist to make an acronym that is a mouthful. So in essence, we are looking for different food components, primarily carbohydrates, that can require the digestive tract to do more work, to spend more energy. And just like how if you run and run and run, you run yourself ragged, you may hurt yourself. If you're forcing the gut to do that day in and day out, it may be intolerant of some of those high FODMAPs. And so you should avoid those in lieu of eating foods that are substitutions and low FODMAPs. So we do find that lots of families, even if we diagnose lactose intolerance, their child continues to have symptoms and they're being perfect on their lactose-free diet. Why, Dr. Reeves, doesn't my kid feel better? Their belly is so swollen, they're having diarrhea. And oftentimes, if we get down to the granularity of their full diet and we implement this low FODMAP strategy, they can be very successful and symptom-free.
Yeah, I'm so glad. See, now that I asked you that question, because it does sort of, again, get to the satisfying part of helping kids feel better, right? So, Pat, we've talked about this throughout the episode because, again, it overlaps with some of the things we're talking about. But I do want to ask you specifically about stomach bugs. What is your go-to advice for parents when a child starts vomiting or has diarrhea? Number one, what do we do? What are we doing?
So I think that most of the parents who grew up in the 90s like I did are going to hear about the rice and bread and water and so forth. Our actual most recent and up-to-date evidence from the American Academy of Pediatrics would suggest a regular diet with some caveats during a bout of diarrhea or vomiting from acute viral gastroenteritis. This is not the time to do cheeseburgers.
Right.
This is not the time to go out for hot dogs. We're wanting to do whole foods, but this is absolutely an appropriate time to maintain, just like the recommendations from healthyplate.gov, make sure we have appropriate proteins, fats, starches, vegetables, everything on board. So what I would say is, if your child is safe to be at home, they're not dehydrated, regular diet is the way to go. I think the bigger question that I get more often is, when should I be taking my child to be evaluated by the pediatrician or even the emergency department?
Tell us.
Especially concerning for babies is wanting to maintain that level of hydration. The most important thing parents already do is track the number of wet diapers per day. And let's say it's 6 wet diapers a day. For me, if you decrease by half and you go from 6 to 3, we are not maintaining our hydration. And it is actually checking that level of hydration through the wet diapers that is more reliable than even trying to take a pulse or looking at their fingernail to see if the nail splashes with color after you press it down. We call that capillary refill. It should happen in less than 2 seconds, but really it's the number of wet diapers that should be the vital sign for parents to know when to seek help.
Yeah, I love that. And it's so important to stay on top of that when this is going on. Now, you again touched on this a little bit, but tell us specifically foods or drinks that can actually make things worse.
Yes, so I would say that things that can make it worse are going to be high sugar beverages. We already talked a lot already about sugars require enzymes. Those enzymes are supposed to be in the hair cells we find in the small intestine, but we can whack those off if there's a virus. And so some of our sports drinks that we tend to use for soccer, basketball, what have you, they're very, very high in sugar.
Yeah.
And what will actually happen is if your child's already having diarrhea, when they drink this, their diarrhea will worsen. And you think you're rehydrating them because you're using some thirst quencher, you're making the problem worse. Now, the other thing needs to be said. We have a really cool transporter, a doorway that lets sugar, salt, and water sneak in and be absorbed. We call it the GLUT5 transporter. So we need a little bit of sugar, not a lot.
Right.
So if you're going for some of our options that are on the market, you should be looking for the low sugar, not the zero sugar option to rehydrate your child, especially if they've grown well in the past. This very new, very acute, lasting 3, 4, 5 days of viral gastroenteritis, they're probably not going to want to eat. And that's totally fine. We want to keep them hydrated. So if all they want is to drink that sports drink, low sugar, not high, not zero sugar, and do popsicles, so long as they're maintaining hydration, either wet diapers or going to the potty to have a pee, that is what we're aiming for.
Love it. And how long is too long, Pat, before we need to start thinking there may be something else going on here?
Again, our rule of thumb is usually 2 weeks, and it's going to be 2 weeks of a child who previously doesn't have any significant past medical history, does not have any scary family history for GI problems, be that mom or dad with celiac disease, mom or dad with Crohn's disease, ulcerative colitis. These are all autoimmune diseases that if mom or dad has them, chances for child have them are increased risk. But if the only thing that's wrong with them is diarrhea, you can give that a couple of weeks. But after 14 days, if that child's continuing to have diarrhea, that is a good reason to seek care in the general pediatrics clinic. Let them ask all of these important questions and then decide, is there testing we can do in general pediatrics to investigate this further? Or do we need to go straight to see the specialist because something is terribly wrong?
Yeah. And sometimes there isn't something that's terribly wrong, but I still really appreciate your input as a gastroenterologist, Pat.
Oh, yeah.
So as we come to the end of our show, you've given us fantastic information today. You may remember we like to end with what we call a parenting prescription. So when it comes to either preventing or alleviating tummy troubles in our kids, what is one thing you want all parents to remember?
I think that the biggest thing that I can offer is that if parents are looking for a program that is safe, that they can use at home, it is the low FODMAP diet. It is basically a good catch-all for lactose intolerance and some of those other food sources of tummy pains. And so if you Google Ohio State low FODMAP, one of the links will come up for you. It says www.CME Outfitters. I don't know why, but that is from Ohio State. And if you click it, it opens Ohio State's Medicine's low FODMAP diet handout. You've got 2 columns, foods to eat, include foods to avoid. And that is the best way. And if you scroll down to the very end, it gives you the step-by-step way to introduce this and to identify triggers to eliminate from your child's diet. If you're looking for other complementary ways to find this, there is information on healthychildren.org from the AAP and information on gikids.org from NASPGHAN, our North American GI Society.
Gotta love a good guide. Thank you so much, Dr. Pat Reeves, for joining us today.
It was my absolute pleasure, Edith. Thanks again for having me.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on YouTube, Instagram, Facebook, and Threads at Healthy Children AAP. And be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos, Kathy Jewell,
Claire Keating,
Doug Nagel,
Jackie Ortega, Susan Stevens Martin,
Mary Claire Walsh,
Hannah Weston.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho-Sanchez. Thanks for listening.